It's April 2020, and today over 600 women will be diagnosed with breast cancer. And couple that with the pandemic that we're currently experiencing, it's no wonder that people are experiencing stress, anxiety, and fear. And so to help us navigate through that, we're joined today by Dr. Bridget O'Brien from Texas Breast Specialist. She is a surgical breast oncologist, and we welcome Dr. O'Brien to our.
Thank you. I appreciate you having me, and I appreciate you doing this for all of our patients.
You bet, you bet. You know, Dr. O'Brien, I know that you've had your own personal experience with breast cancer, and I wonder if you'd be willing to share with our audience, who are often breast cancer survivors, their family members, and their support network, how that impacts your patient care and how you deliver your breast health care.
Sure. I think it allows me to see what the patient is going through and some of the emotions that they're feeling as they move through different segments of their treatment a little bit closer. Although I have not personally been diagnosed with breast cancer, I've had several family members, including my mother and my sister, among others, that have been diagnosed. So I was with them at different points in my life as they went through their treatments.
And those that are in the middle of treatment today and in the middle of a pandemic, what advice would you have for them on what they should be focused on during this time?
I think the best thing right now is to stay focused on staying healthy, trying to stay at home and minimize contact and exposure, and doing what they can to also stay physically and mentally healthy during that time period. I think getting outside, if you can do it in a way that you can maintain social distancing, is great for your body and mind. I think with regard to the breast cancer, staying focused on the positive things. So thankfully, we have had so many studies on breast cancer, and we have learned so much through those studies that allow us to have great alternatives to treat patients with during this time.
Okay, and does that anxiety or stress contribute to more effective or less effective outcomes when it comes to their treatment?
Well, I think we know that stress can affect us in greater ways than we may realize. So anything that we can do to minimize that anxiety and appropriately deal with our anxiety and stress through our treatment or through this pandemic, I believe that will help us better get through this together.
Okay, great. And you know, I know that part of this is just remembering that we need to accept the circumstances that we're in right now, whether it's a breast cancer diagnosis or the pandemic or both. I think that, you know, we need to base if we can, our thinking on facts versus assumptions or versus, you know, what other people might be saying. Are you experiencing any feedback in your office and with your patients of any misconceptions that are out there or any errors in information that are causing undue stress for breast cancer survivors that are currently in treatment?
Not that I have personally heard. I think that our world is changing day by day, and we learn more information each day about the pandemic. I can only reassure our patients that have recently been diagnosed, are survivors, or currently being treated with breast cancer, that although the pandemic is affecting us in certain ways, such as being able to perform screening mammograms or exams, we are still working very hard to see patients in the office in person when the risk of COVID exposure is low and when it is appropriate. Also, we are still moving forward with surgeries when there are not better, safer alternatives during the pandemic.
Mm-hmm. Okay, that's some of the questions that we've received from survivors. For instance, just want to look at my notes here. One of our breast cancer survivors named Karen said that she's currently having issues with an implant, and she was told that even if it is leaking silicone, to fix it would be considered an elective surgery. So the question is, you know, she feels like a survivor and she doesn't feel like it should be elective, but what's the medical advice on that?
Well, Karen, I definitely think you are a survivor, and you deserve to get this taken care of. And if it is leaking, I do think that you should get it taken care of. Right now, you would be able to have that worked up appropriately to see if it is leaking or see if there are any other problems going on. So I do encourage you to do that. As far as the procedure itself, what we are looking at or faced with now is deciding if a surgery is life-preserving. So we are weighing the risk of COVID exposure along with making sure that we have adequate supplies in the hospitals and the risk of the patient. So if your risk of having a silicone implant rupture is and fixing that is considered to be life-saving, or if the risk of delaying would be greater than what the COVID risks are, then we would certainly proceed. For something specifically like a silicone implant rupture, that likely would not be life-threatening, and the surgery would not be considered life-preserving, unfortunately. So we do feel that this is something that can safely wait until we have adequate resources and the pandemic is at a lower and safer point.
And so one of the other questions I've heard from survivors, like Courtney's question, was how will the checkups work for people that maybe are already done with treatment, but they need to go in and get blood work done, and maybe some additional screenings done as they progress throughout their survivorship. How is that handled during this time?
Right now, we are doing a case-by-case basis. So we're prioritizing patients based on their history and personalizing their follow-up to them. So if we feel that it is important to bring you in and perform an exam for various clinical reasons, then we will still be able to do that. If the same is true for labs or imaging, then we will also proceed with that. We do not want to unnecessarily delay or unsafely delay your survivorship exams and imaging. However, if it can safely be done, then we will opt for that as well. We are also doing telehealth visits, so we have the opportunity to have a discussion, see how you're doing, see what the concerns are, be able to do somewhat of an exam through the video chat, and if necessary, then make the decision to bring you in.
Okay. How is that telehealth working for you and others, at the Texas Oncology offices, at the Texas Breast Specialist offices? What has that provided some silver linings on how you deliver care? Is it challenging? How's that affected you and your colleagues?
I think it's been a great resource right now. With anything, it takes a little bit of a learning curve and working through the technical issues of it. But overall, it seems to be working very well. There's a great way to share your screen, so I can review my images with patients. I can draw all over the screen, and we can still interact that way. I can also show their pathology results or other important documents and discuss them so that we can maintain as much of a productive conversation as possible. So I think it's been very helpful, and hopefully it makes it easier for the patient to take less time out of their day to come into the office and then drive back home.
Right, certainly it's one solution to the traffic issues we face so often in our town, right?
Yeah, and I think before we had struggled with being able to utilize video conferencing for patients and telemedicine, but I think that this will further advance us and hopefully allow us to continue this method.
Yeah, it definitely accelerates our transition to some of these mediums that we haven't used before, haven't used as frequently, for sure. One of the other things I've witnessed at Komen is the power of community and how that can help a person that's going through treatment or even recently diagnosed. I can't imagine someone who's diagnosed today during the midst of all this and everything that must be going through their mind. I remember a breast cancer survivor saying years ago, you know, the day that I asked for help and allowed people to help me, that changed everything for her on what her recovery looked like after that. And I wonder, from your experience in working with both with patients and their caregivers, if you've seen that, and what advice you might have for those people that are supporting somebody that is going through breast cancer treatment currently.
Certainly, I think it's very hard for most of us to ask for help or to even know how to ask for help. So, you know, most women are going to work, taking care of the children, doing the various other responsibilities that they have while going through their breast cancer treatment. And I think sometimes they might feel alone in that process, but it is very important to be very forgiving to yourself during the process, and allow yourself to ask others for help and be specific in what they can do to help you, because everyone is different, and those patients or those family members or loved ones that care about you and want to help may not know how to help, or they may feel uncomfortable in approaching that. So I think the more that you can do to vocalize that would be helpful, and to the family members wanting to help, I think the same thing, just asking, how can I help? I would like to help you, and what can I do for you? What do you need? And sometimes it may be something very simple.
Mm-hmm. Yeah, I know, having been in a similar situation before, sometimes you don't know what you need, and it's great to have those folks, even complete strangers sometimes, that show up for you and do something. We've seen that at Komen, right, where people just rally around someone that's going through this experience. And
yeah, I think that's a very good point, just being patient as well, because we may not know what exactly we need or what we want just yet.
yeah, but showing up and being there for someone, maybe just checking in and offering a you know, bit of inspiration or a light in their day, I think would be helpful as well. Doesn't always have to be something, but being present.
Exactly.
One of the other questions that we received was, for some breast cancer survivors, they need their support network, but that support network may be the family members that they're living with, that may be maybe part of essential services that are going in and out of the home. Is there any just functional, practical tips that can help those breast cancer patients stay healthy? Are they at increased risk? I know this is a couple questions in one, but are they at increased risk depending on what stage of treatment they're in or what type of treatment they're in?
If they are immunocompromised by their therapy, then yes, I would be more concerned about their risk, mainly not necessarily in having the virus, but in the complications that occur and severity that of the disease that can occur because of that immunocompromised state. So I would be vocal in discussing that concern with anyone that is coming in to help you, so that they understand the risk and your concern and what you need to feel safe. And then I would ask or request certain things. So if they're bringing goods in, then either you or someone can help clean those items before you're using them. Discuss hand washing before, after any contact, maintaining that social distance. Some family members that are living in the same household, where one is in an immunocompromised state and the other one has an essential job, might still maintain some social distancing from them as much as possible, and doing safe practices such as hand washing and changing clothing, washing that clothing when they get home before they're interacting with their loved ones.
Got it. Is there anything else that's come up for you with the patients that you've been working with since this virus has become the pandemic, that's been a concern that you'd like to address for those that are listening?
For me, as breast surgical oncologist, I'm dealing with surgery. I'm dealing with patients that are newly being diagnosed, and so I mainly would like to reassure them that we are treating you with very good medicine that has been well documented and studied and has great results. So this can be an oral medication for some women. And again, we see great results with that treatment, and that can be extended while we allow for the pandemic to slow down and to arrive at a safe point when we can go to surgery.
Okay. Great. And one of the other things that has happened because of coronavirus is that routine screenings have been delayed, and at Komen, and I'm sure anyone in the breast health space talks about the importance of early detection being important along with effective treatment to reducing the deaths from breast cancer. And I know that at Komen, what we want to do is make sure that women are educated still on the signs of breast cancer, that it can show up in ways that are beyond a lump, knowing your body, knowing your family history, and living a healthy lifestyle. Are you concerned at all, or do you have any women who are calling concerned about the delay in their routine screening?
So I will say that most breast cancers are slow growing, and I do not feel that a delay by a month or two will cause a tumor or an early stage breast cancer to then become an advanced stage breast cancer. So I will say that is unlikely to happen. However, if you feel a mass, if you see a change in the color of your skin, the consistency of your skin, the appearance of your nipple or the areola, if it appears to be retracted, skin dimpling, any of those changes whatsoever, I didn't mention nipple discharge or scabbing of the nipple, any of those things should still be addressed today. And we do still perform diagnostic imaging for those patients. Of course, we will appropriately screen those patients and make sure it's safe to bring you in, but I do feel that it is necessary. If you have a notable change, then you report it to your physician and get the appropriate workup.
Right, we don't want to delay. And have you experienced any changes in your patients too with the economic impacts of COVID-19? Have any of them experienced any financial hardship that prohibits them or changes their course of treatment?
I've had some patients that have had job changes because of the pandemic, so either with reduced hours or being laid off. But I have not had any patients that have had to change what we're doing currently. And thankfully that's the case. I hope it continues to be.
Right, I agree. Well, if anybody does need help, we know that Komen's available, and we're continuing to fund both the diagnostic and the treatment support services in all of our communities. So we're partners with you in that as well.
We are very thankful for that partnership and your ability to do that for patients that are in need.
Yeah, and I will say too, for anyone that's listening, that Komen also funds treatment support in the form of support groups, and so that if anyone is out there that is experiencing an economic or financial challenge, that they should definitely reach out to us, and we'll share that information when we post the video of how you can contact Komen. Dr. O'Brien, I know that amongst all the other things you're passionate about, especially the science and the patients that you treat, the science behind breast cancer and the patients that you treat, education and advocacy is definitely a passion of yours. As we finish up our time together today, I'm wondering if there's anything in particular that you would like to share with our audience what they should know about breast cancer or Komen, and why it's important to support those that are going through that right now.
Well, thankfully, breast cancer, like I said, has the research funding and the support to do several studies in breast cancer. And through that, just in the last 10 years, the treatments that we can use for breast cancer have changed rapidly. We're able to treat patients with better medicines, with better results. And that, from my standpoint as a surgeon, has allowed us to also do more minimally invasive surgeries, reducing the comorbidities or complications that result from those surgeries. So we're always very thankful for any support for research that we could do, and also from a community standpoint to support those patients that may not have the resources to proceed with workup and treatment of their breast cancer.
Well, I want to thank you for your time today, for the care you provide to breast cancer patients in our community, for your support of Komen, and for helping us walk through this unusual time together with some really great resources and tips.
Thank you. I really appreciate it. I think this is very important for patients to hear during this time that can be very scary.
Yeah, I think, hopefully, again, we empower them, connecting them to hope with these resources and experiences and information. So thank you again for your time, and we look forward to talking to you again soon.
Thank you. Appreciate it. Take care.
Okay. Bye.